Hello and namaste from Mumbai. This is Dr. Gaurang here, and I'm going to talk to you about in homeopathy and correlating it with clinical medicine. I'm going to talk to you about just the way a patient walks in your clinic. So I'm going to talk about different gaits. Although my genuine request to you is, when you want to watch this video, before that it would be a good idea for you to read about gait from clinical medicine, possibly from a good book like Hutchinson or Harrison or Chamberlain, and try to understand what is the reason for the gait of different, what is the upper motor neuron, what is the lower motor neuron. So you want to really understand that in depth. What I'm going to try to do is, with my limited knowledge of homeopathy and correlating it with certain homeopathic remedies, and how certain homeopathic remedies have a kind of way of walking, a gait that can help you to think about certain remedies just by the gait. So let's start with the first remedy for today. So number one remedy we'll talk about today is the remedy Lathyrus sativus. It's a very important neurological remedy. Especially you will find this a top remedy in many cases of paralysis, motor neuron disease, ALS, so many things. The main thing here is knock knee, which means both knee are, the whole leg becomes very spastic. So this two knee becomes so very stiff that they just can't move. So it's very difficult for them to move. This is one of the very important indications for Lathyrus sativus. You'll read in detail about it from Homeopathy. Let's come to the next remedy. A very interesting remedy we have in homeopathy, where a very nice introduction is given here, is the remedy Manganum aceticum. And their gait, their feet, you will see, have a peculiar slapping gait, something like this. So they will walk like this. So their gait are slapping like this. Sometimes they also tend to walk involuntarily backwards while walking. Suddenly they'll start walking backward. Manganum aceticum, slapping gait. Or walking backward. Manganum aceticum, also a very important mineral remedy which you want to think about, which has a main symptom of a very bitter feeling. The rubric embittered. Although they are very hard-working, industrious kind of people, but you will read about them that they feel that they don't get appreciation, that people don't value them a lot. So they often feel very bitter, and at some point they develop hatred towards people, and they keep all of this hatred within them. And that is when they want to listen to very sad kind of music. They are so bitter that they want to listen to very sad music. In Indian, like type of ghazals they want to listen to. This is typical for Manganum aceticum. Which remedy will come in your clinic and do like this? Hello sir, how are you? I am having this problem, thoda headache ho raha hai and it's not getting better. What do you think it's remedy? Sulfur. Because standing is the worst position for sulfur. Allen's keynote, no? Also stooping you will see in sulfur, in phosphorus, many remedies. Don't go by my handwriting and don't try to find a remedy based on my handwriting. let's go forward. Another neurological remedy, while walking, they tend to drag the feet like that. This is also very common in one-sided stroke patient or hemiplegia patient where they will walk like this. Okay, that's a circumduction type of gait. But in homeopathy, there is an indication that they tend to drag the feet like this. You can zoom here maybe. It's also there in one of your favorite movies which you might have seen. So this is dragging the feet. You will see this in Mygale Lathyrus. Spider, very important spider. This spider is a very neurological spider which has a lot of spasms on the face. In fact, it is always compared to agaricus. Every remedy I show you, please go back, read it from Boric, Clark, and if you can, Fatak Materia Medica. So they constantly get jerks on the face. So constant succession of convulsive jerks. This is very common in Mygale. So Mygale has this. Another remedy, Nux vomica. Nux vomica is one of the most underrated remedy in neurological cases of paralysis. Dr. Prakash Vakil has written a book on neurological therapeutics many years back. I don't know if that book is available. I had the chance because in my college days, I used to spend more time in the library than in the classrooms, and my whole target was that in 5 years, every single book that would be there in my college, that is CMP college, I would try to go through it page by page. So every single book, I tried to, in my limited capacity of my brain, I tried to go through almost every book. One of them was this Prakash Vakil's Neurological Therapeutics, and he very beautifully compared Nux vomica, plumbum, syphilinum in neurological cases. Read that book at some point. Another remedy is tobacco. So this is very important for dragging. This also happens to me. Awkward. Everything falls from hand. Netramure, Apis, Agaricus, Bovista. Gait. We are talking about gait. Just different kind of gaits that I can give you an idea to this. Another remedy, while walking, they walk very tense. Why? Because their hamstrings become very tight and tense. So the muscles of the leg, typically of the foot, of the hamstring, feel shortened and tight. This is very important for many muriaticums, typically Ammonium, Natramure. Very interesting kind of indication for this. Another remedy, and this is mainly due to a neurological condition, where normally when we walk, if there is something kept here, you'll put your leg up and then try to balance it down. But in this neurological condition, the leg, they don't understand the distance of the leg from the floor, so they kind of put it more higher up. So they walk also, they feel that the floor is up, so they walk. This is very typical of the remedy. Heloderma, a remedy which is a reptile remedy from lizard. Coldness, Arctic coldness. So when you check their foot, they become so cold, icy cold, that even if you put warmth on it, it doesn't get better. Arctic coldness. Heloderma. And just another remedy, while walking, they will walk very so they are very cautious. The most cautious homeopathic remedy that we have their gait, they walk as if their whole body is fragile, made up of glass. The great remedy, Thuya. And then we have a remedy where they feel that the body is made up of lead, and that is Medu. So this is also how you differentiate. But Thuja is one of the most cautious, careful remedy in homeopathy. Very cautious, ekdam, very like that. Alright, this is very typical for Thuya, the remedy. Let's see if I can tell you some more interesting indications. Typically, when you have a lot of cerebellar related issues, and that is when a lot of your coordination gets affected and your gait is really affected, a very important remedy in such kind of condition is sulfonalum. Not sulfur, not sulfuric acid, sulfonalum. It's a very important remedy for cerebellar related issue. Typically, if due to the brain related problem you feel very dizzy, and it's not getting better, think about sulfonal. Very, very important neurological sulfonal. So this is a little idea again about gait, just the way patient works, and there are so many more kind of remedies we can go on for, but such an interesting way of correlating materia medica, repertory and clinical medicine. This is totally an idea that I learned from my first teacher in homeopathy, Dr. Vijay Vaishnav. We used to call him Dr. VV. This is the way he would actually teach very often. And this is the way he used to teach me in my college days. So this is thanks to him. I'm just giving you a little idea of what I learned. But we can correlate, we can coordinate, we can broaden our vision, we can connect materia medica to repertory, and we can really increase our skill set to help our patients more. The idea to tell you this is because there is ongoing courses going on where we are teaching at a daily level, training homeopathic students on all these correlation of repertory, materia medica, organon, with close to 20 global homeopaths coming together to teach, join us. We have the classical homeopathy course, an ongoing course for 150 hours. You can write to me, join us soon. You will get an access for 1 year. This is one of its kind and we would really like to train with you. Thank you and namaste.